Meet Nadia. Nadia is a 17-year-old high school student and an avid member of the school netball and volleyball teams. Sadly, Nadia has had time off school over the past 6 months due to gastrointestinal problems, which have prevented her from enjoying the activities that she loves. Nadia suffers many symptoms that are quite debilitating, including abdominal pain and distension, general fatigue and bouts of diarrhoea. Frustrated and embarrassed by the symptoms, Nadia searched for diet and lifestyle triggers with no luck. At last, Nadia made an appointment with her GP, who ordered a bowel biopsy, abdominal imaging and blood tests. Only a week later, Nadia was diagnosed with Crohn's disease. Crohn's disease is a chronic disease that causes inflammation in the gastrointestinal tract. Most commonly, Crohn's affects the small intestine and the beginning of the large intestine. However, the disease can affect any part of the GI tract, from the mouth to the anus. The inflammation extends through the entire thickness of the bowel wall. Such inflammation can cause abdominal pain, diarrhoea, and a range of other symptoms, including fever and weight loss. Crohn's disease most often begins gradually and can become worse over time. Most people have periods of remission that can last for weeks or years. The disease occurs equally in men and women and usually appears for the first time in patients less than 30 years old, with peak incidence in those who are aged 14 to 24 years. A much smaller population of patients may develop Crohn's between the ages of 50 and 70 years, but the disease can occur in people of any age. The cause of Crohn's disease is unknown, although a family history of inflammatory bowel disease has been associated with its development. All 4 layers of the intestinal wall are affected in Crohn's disease, meaning it is transmural.
Transmural.
The innermost layer of epithelium, known as the mucosa, has a cobblestone appearance due to the development of ulcers that initially start very small but extend as fissures. In some cases, these fissures have potential to deepen and result in perforation of the intestinal wall or to form fistulas with nearby skin or hollow organs. The 3 further layers of the gastrointestinal wall include the submucosa, muscularis and serosa. These layers become edematous with inflammation, and eventually fibrosis occurs as the damaged tissue attempts to repair itself, resulting in extensive scar tissue. When examined under a microscope, the inflamed tissues are infiltrated with lymphocytes and the presence of granulomas, which indicate the chronic cell-mediated immune processes. When looking at the gastrointestinal tract by eye or macroscopically, the regions affected tend to have healthy areas separating the damaged areas, indicating skip lesions. This characteristic of the disease is known as segmental.
Segmental.
Testing for Crohn's disease can be done macroscopically or microscopically. X-rays with barium contrast, colonoscopy, CT, MRI and ultrasonography are methods of assessment where the macroscopic characteristics can be spotted. Microscopically, the presence of immune cells within the affected tissues may be seen. Along with this, examination of a blood sample may reveal an elevation in leukocytes and other inflammatory markers, such as erythrocyte sedimentation rate and C-reactive proteins. Crohn's disease presents similarly to other inflammatory bowel diseases such as ulcerative colitis. However, there are distinct differences in the appearance, pathophysiology and location of the disease that differs greatly to other gastrointestinal diseases. Crohn's disease is specifically characterised by gastrointestinal inflammation anywhere throughout the digestive tract. Inflammation can extend from the esophagus to the colon and rectum, with the inflammation extending throughout the full thickness of the bowel wall, as mentioned before. However, in ulcerative colitis, inflammation occurs only in the colon and is restricted to the mucous lining. In patients with Crohn's, the immune system is hypersensitive to substances and bacteria in the tract. White blood cells invade the intestinal lining and produce inflammatory toxins, which cause the tissue to swell and ulcerate, leading to severe bleeds in the GIT. The inflammation that occurs in Crohn's is patchy and expansive throughout the GIT. Ulcerative colitis is present in localised areas of the large intestine and shows continuous inflammation instead of patchy spread. Nadia's decreased iron and folate levels in her blood work is indicative of malabsorption, and a decrease in iron and folate would be one of the biggest contributing factors to Nadia's general fatigue and lethargy. Nadia would most likely be suffering from iron deficient anemia. A decrease in folic acid is the result of the disease in the jejunum, which is the middle portion of the small intestine. Nadia could also potentially be suffering from folic acid deficiency anemia, and the symptoms of this are quite similar to that of iron deficient anemia: tiredness, lethargy, feeling faint, and becoming easily breathless. This is due to the decrease of hemoglobin in the blood. In many patients with Crohn's disease, like Nadia's, the small intestine's ability to absorb nutrients is compromised, resulting in what is known as malabsorption. Goals for treatment usually include controlling the inflammation, relieving the symptoms, and correcting nutritional deficiencies caused by the disease.
We first met Nadia following a diagnosis of Crohn's disease. Nadia was placed on a class of drugs known as aminosalicylates, which are used to control the inflammation.
Aminosalicylates. Aminosalicylates.
That worked for a period of time, but unfortunately symptoms returned, and it was required to remove a part of her bowel. She had quite severe symptoms of pain and discomfort. It was determined that the location of her irritation required to be removed. In the cases where severe inflammation continues, immunosuppressants in the classification of cortisone treatments are used. Unfortunately, cortisones in long-term usage do have quite severe complications.
Surgery is used to solve specific problems such as stricture, obstruction, fistula, or overwhelming disease with non-response. In some cases, patients with Crohn's may have involvement of Mycobacterium avium paratuberculosis.
Mycobacterium avium paratuberculosis.
In these cases, broad-spectrum antibiotics such as metronidazole or ciprofloxacin may work to reduce symptoms and induce submission. Inflammation affecting all layers of the tissue in the GIT can lead to a variety of long-term complications, including intestinal blockages due to swelling and scarring that can narrow the passage through your intestines. Long term, this can result in constipation, discomfort, and abdominal pain. Chronic ulcers can also form due to the chronic inflammation and can occur anywhere in the digestive tract, including the mouth and genital area. Crohn's disease increases your risk of developing colon cancer, as evidence suggests that there is a delayed detection date for colorectal cancers, therefore there is a worse prognosis. However, with proper medical treatment, most Crohn's patients are able to function well and live reasonable, normal, happy lives.
Diarrhea bum bum, comes out your bum like a butterfly can. Diarrhea bum bum. All shine and yellow leg, black soft ball leg. Diarrhea bum bum. No strain, no pain, just let your bum drain.